You're watching 18 News at 5.
October is Breast Cancer Awareness Month, and keeping with Breast Cancer Awareness Month, WTM Guthrie are teaming up to bring you everything you need to know. And in this week's two-parter segment, 18 News reporter Ariel Salk explains what it means to be high risk and the resources that are available in our community for the women that are.
Being a woman is a risk factor for breast cancer. Men get breast cancer too, but 100 times less frequently than women.
There are many risk factors for breast cancer, including having dense breast tissue or a family history of ovarian, pancreas, or prostate cancer. But having a first-degree relative diagnosed with breast cancer is the most common red flag of them all.
Almost 3 years ago, my aunt was diagnosed with breast cancer and passed away pretty quickly from complications from the cancer. And then last December, my mom was diagnosed. And in the background, my grandmother had, I remember as a kid, my grandmother had a breast tumor.
The first one was my aunt, and I was probably 7 years old. And then my mom, and my sister, and my daughter. So it's been, you know, 3 generations.
Breast cancer runs in both these women's families, but thankfully neither of them have been diagnosed themselves. That doesn't stop them from being vigilant. Randy and Stephanie urging other women to do the same.
I think just as women in general, we really need to wake up and pay attention to changes in our breasts, do self-breast exams. It's all important. And the high-risk breast clinic is just an addition to what we should be doing ourselves.
The Guthrie High-Risk Breast Cancer Clinic offering many resources for women, including risk calculations, genetic testing, and tailored screening plans.
So some people are referred here because of their family history, other women because of certain biopsy results that they've had in the past. And what I can do is help guide women individually to have specialized screening.
Both Randy and Stephanie taking part in twice-a-year screening instead of the recommended annual checkup for women of average risk.
It's proven to be so important to be screened very early, have it found early. And being a nurse, I feel it's important to do preventative health screenings whenever we can.
It works out nicely because it's a twice-a-year screening. We could do everything in one day, but then still would be a whole another year before you're having some type of an examination on your breast. So the 6-month thing works nicely, and it's a twice-a-year encounter with me to have a breast exam as well.
There's always that anxiety, like days before the mammogram and days before the MRI, but then, you know, it's like, okay, if 6 months ago I didn't have anything, so if I do, they probably caught it in time if there's something there.
In some cases, doctors can suggest strategies to reduce a woman's risk for developing breast cancer.
So some patients who have above average risk may benefit from taking an estrogen blocker pill for 5 years. So we may refer them to our oncologist. So again, they don't have cancer, but we are referring them to our oncologist because our oncologists prescribe the estrogen blocker pills, which help reduce breast cancer risk. Not everyone needs them, but we do, you know, there is that option.
Having a variety of options and resources helps put patients of the high-risk clinic at ease.
Oh, they make you really comfortable. They're friendly, and they talk to you, you know, they tell you things that you should know.
She did re-screen me, so we went through the screening tool again, and then she told me what her plan was, what she normally does for women that are considered to be high risk, answered all my questions, and then since then she's been a resource for me to reach out to if I have questions.
Providers from multiple disciplines coming together with one goal, fighting and treating breast cancer when it's small and most curable.
Some patients may need surgery, chemotherapy, radiation, and other targeted therapies. Not everyone needs all of those treatments, but it's important to put them in the right sequence and make sure that the doctors who give the treatments are in agreement as to the plan so that the patient has the optimum treatment.
Unfortunately, there's not a lot of things we can do to prevent breast cancer, but what I can do is help people catch it earlier and to be proactive in their situation.
In Sayre, Ariel Salk, 18 News.
Thank you so much for that, Ariel. And of course, we want to remind you that it's so important to be aware of your status and your level of risk, not only during Breast Cancer Awareness Month, but all year long.